No, good afternoon, Mr. Edwards.
Yes, my Lord. Good afternoon. Thank you. My Lord, this afternoon the inquiry is hearing the evidence of Mrs. Aimee Watt, and her evidence concerns the provision of maternity services at various stages of the pandemic, including at the beginning of the first lockdown.
Very good. Good afternoon, Mrs. Watt.
Good afternoon, Lord.
Now then,
Mr. Edwards is going to ask you some questions. He's ahead of me, so I'll just let him start. Thanks.
excuse me, my Lord. Thank you.
That's okay.
Yes. Mrs. Watt, could you give the inquiry your full name?
Aimee Watt.
Good. And you have in front of you a copy of a witness statement. It's also on screen.
Mm-hmm.
And have you had an opportunity to look over that witness statement?
Yes.
Yes. And you agree that witness statement?
Yes.
And you agree for it to be published?
Yes.
And you also agree for your evidence to the inquiry today to be recorded and published?
Yes.
Yes. Thank you. My Lord, Mrs. Watt's, the reference for Mrs. Watt's statement is SCI WTO 242 5 zeros and a 1.
Okay.
Yes, so Mrs. Watt, as I said at the beginning, you are giving evidence to the inquiry, having responded to the Let's Be Heard invitation, I think.
Correct.
Yes. And the evidence that you're giving concerns your experiences of maternity services during the pandemic, and in particular at or around during the first lockdown.
That's correct.
Yes. Now, Mrs. Watt, you have 3 children, I think, don't you? 2 children, excuse me,
yeah,
forgive me. You have 2 children.
Full-term, 3 pregnancies.
Yes, 3 pregnancies, 2 children. And your daughter was born when?
She was born in April 2021.
And you also have a son?
Correct. He was born in November 2023.
Yes, 2023. So, therefore, your 3 pregnancies very much span the pandemic. Your first pregnancy being during the first lockdown, the second one being mostly during a later period of including the second and third lockdowns, and your third pregnancy after. Well, it's not an ideal way of putting it, but for present purposes, after the pandemic ended or the restrictions ended.
Yeah.
Yes. So therefore, you have experience of maternity services at all stages of the pandemic.
Yeah, just not pre-pandemic, but
No.
yes, otherwise,
Yes.
yeah.
Now, most of your evidence, of course, concerns your first pregnancy, and in paragraph 7 of your statement, you say that in April, that would be April 2020, you thought you were pregnant because you had some bleeding.
Well, not because I had some bleeding, but we'd been trying since we got married in the previous October to have a family. So each month I was kind of waiting to find out if we were successful. So we finally conceived in the middle of March, and I took my first pregnancy test on the 5th of April, which was very faintly positive. And then I waited another 3 days to the 8th of April 2020 and took a second one, and this time it was very clear, yeah.
So you thought you might be pregnant roughly around the beginning of April 2020. Yes, so that's about a few weeks into the first lockdown. Now, on discovering that you were pregnant, having taken the tests, what did you then do in terms of health services?
Well, I think I can't remember how I became aware, but I was aware that you had an appointment at 8 weeks and that I was to email the midwives in charge of my local area's care for maternity services to request a booking appointment at 8 weeks. So at that point, when I did the first pregnancy test, I was 4 weeks gestation, just over 4 weeks gestation. So I waited until the 14th of April, so I was just coming up for the 6-week mark, and emailed in then to make the first appointment with the midwives.
Yes. And once you did that, in paragraph 8, you explain that you got your 8-week booking appointment.
Once I'd emailed in, I received the 8-week booking appointment for the 28th of April.
For the 28th of April. Now, in paragraph 9, you say that you were surprised, and I'm mindful it was your first pregnancy, you were surprised that you wouldn't go to see a doctor for any additional test. Why were you surprised at that?
I just thought someone would get me in and say, yes, you're definitely pregnant, and this is what happens next. I was surprised that I went straight into meeting midwives and having blood tests and urine samples done without confirmation of that pregnancy.
Yes. Now, you then go on to discuss your experiences with the NHS in the weeks after that. In the weeks after week 6 of your pregnancy, so that's roughly about the middle of April 2020. But unfortunately, as you say, in week 10, in paragraph 10, in week 6, you experienced some bleeding.
I did, yeah.
Yes. Now, what did you do when you saw that or experienced it?
Well, I can be a bit of a worrier, so the first thing I did was wanted to check that I wasn't jumping the gun and contacting my midwife when I didn't need to. So I went to the NHS website, and it informed me that for any sorts of bleeding at any stage in pregnancy to contact the maternity services straight away so you can get checked out. So the first time I experienced bleeding was on the 17th of April, Friday evening. I was 6 weeks and 2 days gestation. I called triage because I think I tried the early pregnancy unit number and it was unavailable, or I think it was maybe out of hours. I think they were only open until 5 o'clock or so. So I called the maternity triage for some advice. Do you want me to continue?
Yes,
Yeah.
no.
So when I
very
spoke
clear,
to the midwife on the phone, she kind of went through. It felt like she was just reading from a script. She asked me various questions: how heavy the bleeding was I experiencing any cramping, that kind of thing. And she deduced that because the bleeding wasn't heavy and because I hadn't experienced any cramping, she advised that she wasn't concerned. She said that if anything changed, so if the bleeding got worse or if I was to experience some really painful cramps, then I was to phone back and get some further advice.
Yes. Now, that was on a Friday, I think, wasn't it?
That was Friday evening, yeah,
Yes.
the 17th of April.
Now, you go on then to explain that during the night, I think it must have been Saturday into Sunday?
Yeah, it was 4 a.m. on the Sunday morning, 19th of April.
Something changed in it at this time. You did have cramps.
Yeah, I woke up, I was sleeping and I woke up to some quite painful cramping. I didn't know what to do at first. It didn't feel like a regular period kind of cramp. It was a lot stronger. So I just lay in bed for a few minutes, just breathing through it and just kind of sussing out what was going on. And then it kind of subsided. I fell back asleep. And when I woke up in the morning, I spoke to my husband and he kind of said, maybe we should, although you're not still having that, maybe we should phone the hospital and see what's going on.
And is that what you did?
Mm-hmm. Yeah, with it being
so
the
this
weekend
would be the
again.
Sunday morning now?
Yeah, so Sunday the 19th of April, sorry. Mm-hmm. So I was 6 weeks and 4 days by this point. We phoned again, I think it had to be triage because it was out of hours for the early pregnancy unit. I explained that I'd had cramping and that I'd phoned on the Friday and been advised that if I was to experience cramping, then I should phone back. They told me that they asked me a series of questions: how heavy the bleeding was, had it changed, and it hadn't. They advised that because I hadn't needed to take any painkillers for the cramping, again, they weren't concerned, and to just monitor the situation. And I was given the same advice again: if it changes or things got worse, then to phone back.
Thank you. Now, At this time, of course, it's April 2020, so it's very early in the pandemic. And do you remember what the information was or any guidance? You say, for example, that you were doing quite, at the end of paragraph 11, you say we're doing quite a lot of research online. Do you remember any particular guidance or information about the implications of COVID-19 for people who are pregnant, for women who are pregnant?
I don't remember the specifics. My friend was in late pregnancy just before we went into the lockdown, so and I remember having a conversation with her saying, do you think you're going to have to stop coming to work? And she just laughed and said, why would I have to stop coming to work? And I said, well, I think pregnant people are going to be classed as high risk, and I think it was the next week that happened. So I know that we were definitely classed as high risk at that point.
How did you know that, or how do you remember
because
that?
she had to stop going to work.
Right.
She had to that was before the lockdown hit, and she had to stop going into our office on that basis. And then by the time this was going on with the bleeding, I remember when I was wanting to take a pregnancy test that as we'd been trying, I'd actually finished the last one in the box. So the day that I suspected I might be pregnant, and I'd started to feel nauseous and things, I didn't have a pregnancy test left, and I'd wrote in my journal at the time that we had to wait until the next day when my husband did the food shopping, because we were only allowed out once a day at that point. So we had to wait the next day for him to go and get more tests before we could do that. So I believe we were at the stage where once a day for exercise or going to the shops or whatever.
Now, in paragraph 13, you then talk about the attending at the, which I think would be the week 8 appointment, is that right? This is now the end of April.
28th of April,
yes.
Yeah.
And you make the point that you had to attend that appointment alone. And I mean, I'll mention here that this is one of the important themes of your statement, that at various times you could only do things alone.
Correct.
Not in the company of your husband. But even at the week 8 appointment, your husband wasn't allowed to attend.
That's correct. I'd emailed when I did the emailed to make the appointment. I followed up to say that I would be able to attend on the 28th of April and asked if my husband would be allowed to attend with me, and they said no, not at that time.
Now, at the week 8 appointment, in just a little further into paragraph 13, you discuss what I think is your surprise at this time of not being assigned a specific midwife.
Yeah.
Yes. Why were you surprised at that?
I just assumed, similar to a GP, you would have a named person responsible for your care to kind of have an oversight of, say if you had any high risk medical conditions, or just your progress throughout the pregnancy, just to keep you informed, or if I had any questions, then I thought maybe I would have a point of contact that was one named person, but that wasn't the case.
Has that been the case with your later pregnancies?
With my daughter, I think it was a mix. I think there was a named person, but for every appointment, I think I had a named person on record, but for every appointment I attended, it was a different person in attendance.
Right.
And with my son, just who was born just in November there, we had a named midwife throughout my care.
But in relation to your first pregnancy, that wasn't the case?
No.
No. And in paragraph 13, quite a long paragraph, sorry, but in paragraph 13, you also talk about some surprise at midwives, dealing with multiple people rather than with limiting their contact to people.
Yeah, so they
want to explain
that at the appointment. They explained, I think I'd had to travel in for it, and they kind of apologised and said, sorry, I had to travel for your appointment, but we've kind of, I think they said they were bringing everyone to one central location for the appointments, as opposed to having I suppose different hubs within the community areas.
It might be worth just highlighting this in your own words, if you can just see pre and post pandemic in paragraph 13.
It's quite large script, sorry.
And I can read it if you prefer.
Even just if someone has the cursor, could you highlight it for me?
Yes, it's,
Just so I can see where.
No, it's in 13. It's just a little bit I'll read it.
Okay,
And I'll ask you.
yeah.
So what you say in paragraph 13 is pre and post pandemic.
Oh, yeah.
Booking appointments were undertaken by a community midwife in your area, as opposed to during the pandemic, where you were asked to travel to a hub where people from all over the district were attending.
That's correct.
That's your
yeah.
experience. And what was it that surprised you about that? In the conditions of April 2020, I should add.
I think it was that everyone was attending one place. So to me, I was nervous because I felt I'd been informed I was a high-risk category, and that I should be limiting contact with people. I'd stopped going to the shops, I'd stopped going out for walks because I was trying to limit how many people I was coming into contact with. But when I went to an appointment, I was seeing a midwife who was seeing people from all over the Falkirk district, rather than someone who was only seeing people, a select number of individuals within my local community.
Yes.
It was almost as if the staff members' health was being prioritised over myself, who was classed as a high-risk category.
Now, in paragraph 19 of your statement, you say that even after the week 8 appointment, you were still nervous about the pregnancy.
Yeah, so I discussed with at the week 8 appointment, they did basic medical tests. So they took my blood and they took a urine sample. I remember asking at that point if they were going to be checking my urine to confirm that I was actually pregnant, because as I said previously, this wasn't done via the GP. Nobody had confirmed this with me so far, other than me doing my own pregnancy test. And because I'd experienced the bleeding and I hadn't had any sort of an appointment to check everything was all right, I thought perhaps the midwife would be doing a pregnancy test just to check that everything was okay, and it seemed to be that I was still pregnant. And she just kind of laughed and brushed off and said, "Well, we assume you know that you're pregnant before you come in." So. So I'd the bleeding, although it hadn't got worse, it was kind of just ongoing. So I, at this point, was nervous because when I had the 8-week appointment, they'd already booked my scan, which was in week 12. So I had almost 4 weeks left before I'd have any sort of reassurance that everything was okay with the baby. So I was nervous at this point.
And I think you said that you did another pregnancy test and it came up with a failed
My mum had
positive.
suggested that as peace of mind. She thought that if I was worried, then why don't I just do another one? So I did do another one, and there was a faint line on the test. But because in pregnancy, I don't know if everyone's like this, but I get very thirsty. You have to drink a lot more water when you're pregnant. So I just kind of put it down to maybe I've diluted my urine a little bit more, and maybe it's just kind of diluted that line.
Yes. Yeah. Did you seek an early pregnancy scan from the NHS at this time?
No, I suppose I probably didn't ask for one outright, but I felt when I had been phoning the hospital, that was kind of me reaching out for some sort of support or assistance, yeah. And that wasn't offered.
But you were under, you thought, or you understood that early pregnancy scans from the NHS were suspended due to the pandemic. Did you say in paragraph 20?
I don't think I was aware of that until I booked my own private scan, and it was the sonographer at the private clinic that advised me that the only reason they were continuing to offer private scans was because the NHS had stopped doing theirs.
Right. So you begin talking about this in paragraph 21 onwards. And so in order to seek assurance about your pregnancy, in around early May 2020, you travelled to Glasgow for a scan at a private clinic, is that right?
Yes, so just before that happened, I'd made my third phone call to the triage team because the bleeding did get heavier.
Right.
So between the 18th and the 20th of May, so it was the end of week 10, beginning of week 11 gestation, the bleeding did get heavier. So I phoned it always just seemed to happen in the evening or on the weekends. So again, I phoned the triage team. They explained that because there was no cramping, they still didn't have any concerns. And I got quite upset on the phone because they said that, at this point, I think they did mention a scan. They said that because I already had my 12-week scan booked, which is, the midwives had booked that at my 8-week appointment, because it was already booked for, I think it was the 28th of May, they couldn't get me in any earlier than that, so I would have to wait for that scan.
That would have been the week 12 scan.
For the week 12 scan, so this was the end of week 10. And but then instead of saying she wasn't concerned, she didn't have any concerns, she phrased it slightly different this time, and she said that as long as I wasn't bleeding heavily and I wasn't in too much pain, then that's all they were worried about. They were worried that I wasn't going to bleed too heavy or that I wasn't in too much discomfort. And I hadn't realised until that point that when they were saying they didn't have any concerns, what they meant was if I was losing the baby, there was nothing they could do about it. What they meant, they didn't mean that the no concerns meant that my baby was safe. Mm-hmm. They meant that all they were worried about was my health. And nobody had been that direct with me. They
told you that, or that's how you understood them?
That's how I took that to be, because she specifically, before they never said we don't have any concerns for you. This time she said we're not worried about you. We're thinking about you at this time. Mm-hmm. And as long as you're not bleeding heavily and you're not experiencing too much discomfort, then kind of they're not too worried. And because she'd slightly phrased it a little bit differently at that point, that's when I understood what she really meant was that, you know, there was nothing really that they would be able to do for the baby if that's how I was taking that to mean.
Yes.
So when I came off the phone at that point, I was devastated. The thought of waiting for my 12-week scan at that point, because like I say, I think that was the 20th of May, and I think it was the 28th I was due to have the scan. It was 8 days. I mean, every hour was a struggle. I couldn't focus, I couldn't think, I was just worried, I couldn't eat, I couldn't sleep. So I think I took a day's annual leave off my work on the Thursday. That was a Wednesday. And then on the Friday, it was a public holiday, my husband was off, and he kind of approached me and said, look, I've been looking into private midwives, because he knew I was so nervous, and I was feeling so scared, and we didn't feel like we were getting the support we needed. So he'd been researching private midwives, and he said, why don't we hire our own private midwife? And it was at that point, he gave me the information. I went away and had a look at their website, and I noticed at that a wee link on their website saying book a early pregnancy scan. And I thought, I tried clicking on it thinking it was just going to say not available at this time or something, but there was actually an availability for an appointment the following day on the Saturday. So I said to my husband, you know, before we go down the route of booking a private midwife, why don't we attend a private scan first and see what they have to say? And I think at this point I knew it wasn't good news. I just knew it. So that's kind of what led us to going to that appointment at the private clinic. Yeah.
Now, that took place on Monday the 23rd of May, I think?
No, that was when I visited the hospital. So this happened on the Saturday, the 23rd of May, was the private scan.
Right, so you travelled to Glasgow and you attended the clinic, but when you and your husband arrived, they told you your husband wasn't allowed to accompany you either, is that right?
I knew that before I arrived, yes, so he waited in the car.
Yes. So at the clinic then, what happened and what did you learn?
Yeah, so I arrived at the clinic and I was early because there was no traffic. We hadn't anticipated how quick we would get to Glasgow from central Scotland. So we arrived early, we waited in the car I think for about 15 minutes, and then I just decided to go in. I was still about 15 minutes early, they allowed me to go in. The receptionist was lovely. She got me a glass of water. She said the sonographer would be with me soon. And despite being so early, the sonographer came and got me quite quickly. She took me into the appointment and I lay on the bed and she started doing the scan. So it was the first time I could see the baby on the screen. She had to zoom in quite far and its features were all fuzzy.
Yes.
But it was quite clearly a baby there. And so she asked if I was sure of the dates, and I said yes, because we'd been trying. I was positive of those dates. And at this point, I think I was around 11, just very early, 11 weeks pregnant. And so she spent a wee time kind of looking around my tummy, and she just said that she was sorry she couldn't give me any good news, and that the baby had stopped growing at 8.5 weeks. And I just had this heart-wrenching, horrible feeling. I just felt like I needed to escape that room. So she got me some tissues. She went and got me a glass of water. She said that she was going to prepare a report for the hospital and print me off my photos, so she did that. And then she went away and did all that, and I started to get my stuff together, and she gave me my photos and everything in a little envelope, and a paper envelope, and I bent over to get my bag and I forgot I had my water in my hand. Spilled my water all over everything, so she was really nice about it. She went and printed it all again for me and gave it to me, and she said, I asked what I had to do next.
Yes.
She said that I would have to phone the hospital. She asked what hospital I was with. And she asked if I would like her to do that on my behalf.
Yes.
So that they could expect me to go in, because she said, I think she told me, sorry, just to rewind, I think she told me that she also worked for the NHS, but she did private scans on the side. So she was a sonographer with the NHS, but she did private work as well, and that's why she was there. So she said that she thought I would be called into the hospital that day and then given my options from then on.
Yes.
So she tried phoning the hospital, but she couldn't get an answer. So she gave me the number that I needed to phone. She asked me if I wanted her to phone my husband for me. He wasn't allowed in, but she said, do you want me to give him the news? And I just said no, I just kind of wanted to go and just grieve.
And so just to be clear then, what she was explaining was that you'd had a miscarriage.
Yeah. I was afterwards. I'd read the report that she'd provided for the hospital, and it was classed as a miscarriage. And what that means is that the baby has stopped growing, but basically your body hasn't realised that you're no longer pregnant.
Yeah.
So there's no heartbeat, and the baby had died.
But you were still experiencing symptoms of pregnancy.
Yeah, and I had my morning sickness had got fainter. But given I was approaching 12 weeks and I'd also made some dietary changes, I kind of just brushed off and put it down to that.
Yes.
But my breasts were still tender. I had a little bump, and I know that's silly because it was so early, but like looking back at photos now, I really did have a bump. I was exhausted, so all the kind of things you'd expect in early pregnancy I was experiencing, although the morning sickness had got a bit fainter, yeah.
Now, I think you said earlier that this was a Saturday, is that right?
Yes,
of
the
a
private
holiday
appointment
weekend.
was on a Saturday,
Yes. Now, when you had the report and you got home, when did you contact the doctor or A&E, or what did you do next?
It wasn't A&E, so the protocol is you would phone triage, which is kind of the maternity's emergency service, if you like.
Right.
And I think I needed a wee bit of time after travelling home just to gather myself. So I think I phoned maybe a half an hour or so. I had a cup of tea, half an hour or so after getting home.
And you did phone and you got an appointment on the Monday, is that right?
Yes.
Yeah.
So I phoned thinking that they knew that the result, that they would get me in quite quickly, because by this point it was almost approaching 3 weeks since the baby had stopped growing, and I thought maybe I'd be at risk of infection, or I just thought I'd be some sort of priority, but they told me that they wouldn't be able to see me until the Monday. They booked me in for an appointment then.
Right. Now then, on the Monday, you went to the hospital?
Correct.
Yes. Which hospital was that?
Forth Valley Royal Hospital.
Okay. And you went to the appointment alone, did you, or did your husband accompany you?
So nobody had specifically said he wouldn't be able to attend this appointment. And I know that he hadn't been able to attend other appointments, but given the nature of what we were experiencing, I thought he might have been able to come with me. So we arrived at the hospital and we had to go into the same entrance as other pregnant women. And when he did come with me at this point. So when we arrived at the door, I was greeted by a member of staff who said, I'm sorry, but you can't have a chaperone with you today. So I explained that we'd received quite bad news and I'd been asked to come in for an appointment. So she said, okay, you can go on. So she allowed my husband in. The next step was we got to a reception desk in a busy waiting area, and although the waiting area was busy, it was all socially distanced, as you'd expect. And we had to stand behind this 10-foot marker, which separated me and the reception desk, and the reception desk had a big plexiglass screen in front of it, and then maybe another 10 foot or so was the receptionist. And as soon as we approached the desk, they said, I'm sorry, but you can't have anyone with you. So again, I had to explain.
So that's the third time you'd been told that?
Second at this point.
Right.
So I explained why I was there, but because we were in a waiting area and we were so far away from the receptionist, I had to raise my voice and speak quite loudly in front of the whole of the waiting room and explain that we'd had bad news and I needed to have my husband with me. So the reception again, they allowed me to continue, and they pointed us down. I hadn't been into this area of the hospital before. I'd never been to maternity unit, so I didn't know where I was going. It wasn't familiar to me, so they gave us directions to where we were supposed to go, and I was greeted by a member of staff who again told us that my husband would not be allowed to stay. And I think at this point I just completely broke down. And I said, like, I'm not capable of doing this on my own. So she allowed him to stay, but she wanted to find us a private space together. So, and I think that was more for social distancing as opposed to, because of the trauma I was going through. It wasn't, I didn't get the impression it was for my welfare. So she walked us around several different areas, all of which had other people in them. So we went back to the first place that we were in. All the while I was just devastated. I was crying. My husband was having to support me. We got back to the original waiting room, and then she told me we would just have to wait there until I was seen for the appointment.
Right. If I can just ask you to pause there for a moment. You discuss all of the matters that you've just been talking about in paragraph 30 of your statement. But if you're happy to continue,
Of course, yeah.
In paragraph 31, it's important to note that, of course, you did have the report from the private clinic explaining what had happened. And you had that with you, yes. And when you were eventually seen by a nurse, you showed them that report.
Yeah, I passed them the paperwork.
And what did they say?
They said that they weren't able to take the word of the private clinic and that they would have to do their own tests and scans.
And what did you think about that?
I don't know if I'm allowed to say out loud. I was rather annoyed.
Right.
I felt that the sonographer was qualified. And she was medically qualified to give me a scan. She worked for the NHS herself. It was a full report. The scan had there was detailed pictures. I felt I was quite surprised that I'd have to go for another pregnancy scan.
Yes.
And I was really, I didn't want to do that again.
Now that's what happened, isn't it? You were then taken at that time. Is that right? That was the next thing that happened.
So
was it?
when we were in the waiting room, we waited half an hour. We were taken through and asked some basic questions by I can't remember if it was a staff nurse or a midwife, And then we were taken back to the waiting room. At this point, I was told, so my husband was allowed into the first part. I was told at this point he would not be allowed into the scan, and I had to wait for the sonographer to come and get me. So she came along and collected me down these wee windy corridors, along past a shop that staff were sitting having their lunch, past like a public stairway, past that reception, past all these different people, into a wee scan room.
So you had to relive the experience of the scan.
Yeah.
Yes, and you found that distressing.
Yeah, I asked for the monitor to be turned away. I didn't want to see it again.
Now, the result of the scan was obviously the same, and the next question is what was going to happen next. That was what you were concerned about, wasn't it? Or one of the things you were concerned about. And so was that discussed with the sonographer at that appointment of what would happen next?
So the sonographer's job was just basically to check the status of the pregnancy, I think.
Right. So where did you go next then after the scan?
So she did a scan on the outside and then asked to do an internal scan. And then after we did the internal scan, she kind of directed me back to the waiting room. And I just, that it was just a bit of a daze because, like I said, it was, all these different corridors and loads of people walking about, and she just kind of sent me on my way back to the waiting room. And she kind of said, "Do you remember where you're going?" I said no. So she just kind of hand gestures and sent me on my way. I went back to the waiting room to be with my husband, and then I think we waited again to be seen by the same, I can't remember if it was a staff nurse or a midwife.
Or midwife, yes. Yeah. Yes, so in paragraph 33 of your statement, you say the next stage of this procedure was to talk with the midwife about what would happen next. So what were the options as she explained them to you? Yeah, so
she explained that in usual circumstances they would be able to offer a D&C, but they've had to have stopped all of those with the pandemic. She said that another option they were offering was called something called a vacuum, which I later in my third pregnancy learned, I think it means the manual evacuation of the womb. She said that they were holding one of these appointments per week for circumstances similar to my own, but unfortunately that week's appointment had already been taken. So if I wished to go down that route, then I would have to wait over another week, about another week and a half for that appointment. She said that their other option would be something called, let nature take its course, I suppose, but I didn't feel like that was an option considering 3 weeks had passed and things weren't moving along on their own. So the last option was something called medical management, which is a tablet that you can take to, I think it basically just expels everything from your womb.
Yes. So the options then were a D&C, but those procedures had been suspended, that they told you, yes. The next option was a vacuum procedure, but that was only
once a week.
Once a week, because of pandemic conditions, as you understood it, is that right?
Correct, and someone had already booked this week's appointment.
Yes, and then the third option was letting nature take its course, and the fourth option was medical management, either in hospital, or fifth option, I suppose, 4 and 5, medical management in hospital or at home.
Correct.
Yes, and what did you decide to do?
I asked what would happen if I was to remain in hospital, and they said that my husband wouldn't be allowed to stay. I'd be given a private room, but no staff would be allowed to accompany me. I would take the tablets, and then you have to wait 4 hours. It has to be done in the morning as well, so it would have to be done in the morning. By this point, it was too late that day, so presumably I would have stayed in overnight. I would take the tablet, I would wait 4 hours, take a second tablet. Every time I went to the toilet, I would have to use a bedpan, and the staff would check the contents to check that everything had passed the way that it should. So I'd asked if anyone could stay, they said no. I asked what would happen to the baby, they said that they could collect it and take it to the morgue. and all the babies in similar situations would be cremated together, and the ashes put in the gardens of remembrance at the hospital. So that option, I felt for that reason, would have been something that I really wanted to do. But I just didn't think I could do it on my own.
No.
So I decided to do with the medical management at home. And it would be a similar process, but it would be in the comfort of my own home, and my husband could be there with me. And when I asked what would happen to the baby at that point, she said that most just get flushed down the toilet.
Yeah, at home, that is. Yes. So, if I understand correctly, your preference would have been to be able to stay in hospital, to have the medical management in hospital because of the...
For them to take care of the baby afterwards.
Yes, because there would be a cremation.
Yeah.
And the ashes would be in the Garden of Remembrance, but you didn't feel able to do that because you would have to do it alone.
Yeah, and I just didn't know how long it would take, and it had just been going on for so long, I just couldn't do it anymore.
Right. So you went back home, and you then took the tablet in accordance with the instructions, and then you lost the baby.
Yes, but not as quick as
Not as quickly
all
as
that.
that, no,
Yeah,
but in
it
due
took a long
course,
time.
It took a long time, yes.
I didn't think it had worked. I was advised that if I had any concerns to wait the full 24 hours and phone triage again the next day. They explained in quite a lot of detail what to expect when I took the tablets and what my body would go through. And they said the cramping would get more and more intense, and when it peaked, after that peak, things would come away. It would be quite noticeable, and then after that, things would subside, and that would be a sign that everything had happened the way that it should. That didn't happen. So the next day I phoned and explained what had happened. That the cramping did peak and then go away, but after the cramping peaked, nothing really happened. And the midwife explained that, again, they weren't concerned. They were satisfied that everything had happened the way that it should have, and that I was now discharged from their service. And over the course of the next couple of weeks, there was signs of infection. Again, the way things had been described to me, it wasn't following a similar pattern. So I phoned triage again and said, I don't think this has happened, or it's fully happened yet. And they looked back at my maternity record and said that I had been discharged from their service. They were satisfied that everything had happened, and if I had any further concerns, to phone my GP. So that's what I ended up doing.
And what did the GP have to say about that?
She was quite shocked. She said that given the symptoms I was experiencing, it was quite possible I was experiencing an infection. She said that she would refer me for a private scan, not a private scan, sorry. She would refer me to the pelvic ultrasound department for a scan. Unfortunately, she wouldn't be able to refer me to the maternity department for a scan because they'd discharged discharged me. But because I was having to go to the pelvic ultrasound, I would have to wait another couple of weeks before they'd be able to see me. And in the meantime, she would give me a course of antibiotics. And I think this was around the 6th of June, and it was about a week and a half after I seen the GP, just a few days before my my pelvic ultrasound, that I was in the bath and more tissue came away, and I almost instantly felt better. So I still went to the pelvic scan just to get the all clear, and at that point they told me it looked like it had ended.
So in this whole experience of about 3 weeks or something like that, you don't feel that the procedure worked as they had told you it would?
No. And just as a side note, I have a history of what they call retained products of conception. My daughter, my second child, well, second pregnancy, she had a retained placenta after her, which ended in infection again, because even after manual removal, I still had retained products. And my son, in November, I experienced the same again. So it is something my body just seems to do. It's not, it just doesn't seem to give things up easily.
Would you say that you felt supported by maternity services during this experience?
Not in the slightest. I would say every single interaction I had with the maternity services was a disappointment, and I felt let down. Every single one. But I have to say my other pregnancies, absolutely, I felt supported.
Yes, thank you. Now, there is, Mrs. Watt, one other issue which you raise in paragraph 39 and 40 of your statement, which concerns the impact of this on your mental health, and also the support available or not available in relation to that. So did you want to say something about that?
Yeah, so I think it was just after I'd taken the tablets, I couldn't sleep. I couldn't sleep. That had been going on for a while since I'd found out that I'd lost the baby, had stopped growing. And I think I was just terrified that every time I would close my eyes, I would dream I was still pregnant. I just couldn't go to sleep. I couldn't go to bed because every night when I was pregnant, I would have a little conversation with my baby. I'd rub my tummy, and I would do the things that you would do. So the whole environment for me, I just couldn't go to the bedroom. I couldn't go to sleep. I couldn't eat. I was in a really bad place. I was at a real point of crisis. So I phoned the GP, having had a history of mental health and depression and anxiety in the past. I've always been really good at keeping on top of my symptoms and managing them very well, but the things that I would normally do to help just wasn't working, and I knew that I needed intervention. So I phoned the GP, and when the GP reception answered, she asked if I was requiring an urgent appointment, and I said I thought so. I felt like it was urgent. And she said, well, can I ask the nature of the appointment? And at this point, I just kind of broke down. And she said, is it mental health related? And I said, yes. And she said, well, I'm really sorry, we won't be able to offer you an appointment. She said that they were no longer offering mental health appointments through the GP practice due to the pandemic, and that if I required that sort of support, I would need to go to a local charity called the Falkirk District Association for Mental Health, shortened to FADAM, and ask for their support instead. And so I managed to explain that I'd had a miscarriage, and that I know how to deal with bad mental health, but this time it's not working, and I really felt I was at crisis point, and I needed something to help. And she was sympathetic, and she said that she would speak privately with the GP and see if there was anything they could do, but it wasn't guaranteed, and that she would phone me back regardless of the outcome. And I think within 15 minutes the GP phoned me back himself, and he offered me some sleeping tablets and other support. But again, if I wanted counselling or anything like that, then I would have to go through the charity.
Right. So just to be clear, I mean, I don't want to have to repeat it, but it is an important piece of evidence that you're saying that you were told by the GP that because of the pandemic, they couldn't offer any mental health appointments.
The receptionist, not the GP.
No, sorry.
The GP practice reception.
GP practice told
correct.
you. Yes. Yes. Well, Mrs. Watt, thank you very much. I mean, that is all is very distressing and difficult subjects to go over again. You then go on to, in paragraph 43 onwards of your statement, to say what you consider to be the impact of the pandemic on pregnancy. And in paragraph 45, indeed, you highlight several matters that you would want to identify. I mean, would you want to say what they are?
In terms of area, I would like to see.
What would you, first of all, what would you say in summary about your experience of the pandemic on your maternity experience?
I would just say I would never want anyone to ever go through something like that. I felt like I was a nuisance. I was left feeling just worthless. You know, I wouldn't even say I felt alone. I think it goes way beyond that. I felt like me and my baby just weren't deserving of any care. And I think I was just so completely in love with this little thing from the moment, probably even before I knew it existed. Mm-hmm. And it was the most precious thing in the world to me.
And given your what you've experienced with your daughter's birth and your son's birth, what would you say you would like to think are the lessons learned, or should be the lessons learned from what you experienced with your first pregnancy?
Yeah, I think there's 3 areas of lessons learned. I think you should always be allowed to chaperone when you're going through a trauma. I think I needed someone to advocate on my behalf. I had no capacity to make medical decisions for myself. I wasn't in a place to listen to what they were saying and understand instructions about taking this kind of medicine. And that's aside from the support and comfort that a chaperone would be able to offer you. I think that should just be a given. I think I understand they were trying to limit contact with unnecessary individuals, but from what I understood at that time of the pandemic was that I lived with my husband 24 hours a day, and whatever I had, he had. So why could he not be there with me? Because they were coming into contact with me anyway. We were in a bubble together. I couldn't understand that. Second, I think that there was just a whole lack of compassion from the very, very beginning right through my whole experience with my first pregnancy. I was left feeling lost. I just didn't understand. I felt like I'd done something wrong. With I can't say with that first pregnancy that I ever had a positive interaction with the hospital or the midwives that I was working with. I just, like when I was getting upset, they never even offered me a tissue. Mm-hmm. No one walked me back to that waiting room, despite the fact I was walking past a busy reception, staff having their lunch, and I was just crying, Like, they kept calling it the pregnancy. They didn't refer to it at all as my baby. It was very medical. It was very kind of distant from what I was experiencing. There was no one kind of, there was no bonding. They didn't recognise, it felt like they didn't recognise what I was going through. It was like they'd just been kind of, they just got so used to it that there was no feeling there. I felt like I had to constantly explain to the hospital why I was there and the concerns I was having. And I just felt like I was dismissed for not experiencing the sort of textbook symptoms that a lot of women experience. And because I didn't follow that textbook path of what they would expect in that situation, I was just dismissed as and not a concern. The third thing I think for me is the lack of services. I think looking back at my journal and my kind of from that time, I don't think I ever once managed to get through to the early pregnancy unit on the phone. Every single time I phoned, I had to then resort to phone and triage instead. That in itself just feels like no one's interested in that call that you're making. And I was really worried. So when I was making a phone call, I was hanging up, waiting a couple of minutes, trying again. And nobody was answering that phone. Mental health support, again, we mentioned that, but lack of services there. I wasn't offered an early pregnancy scan through the hospital. I wasn't even offered a postnatal scan, which I can say would be standard protocol, because in my third pregnancy, I was offered a scan at 8 weeks for very similar circumstances, bleeding. And I was reassured at that point, and we heard the baby's heartbeat. But I was offered an early pregnancy scan with my third pregnancy, and I was also offered a postnatal scan because I had symptoms of retained products. But in the first pregnancy, that was just not an offer at all, either before, during the miscarriage, or afterwards when I suspected there was tissue left behind. I mean, I was discharged instantly from their service, but with my third pregnancy, I was still on the triage. They still had my account open at, I think it was like 4 weeks postnatal. I went up to 6 weeks by the time things were finally finished with that one too. So, you know, why did they shut me off so quickly? And the lack of services again, you know. One of the things I find so difficult about that time is that the way it ended for the baby. I just think it's horrific to expect that a baby should be flushed down the toilet and that's normal. I felt like they should have done everything to support me in being able to get that baby a cremation. I'd found out afterwards from a friend who went through two miscarriages at the exact same time as I had mine, that she was able to collect her baby at home and take it to the hospital, and then she was able to arrange a funeral. Both of her babies, even though they were tiny, tiny babies just like mine, both of her babies were offered a funeral. I mean, she had to pay for it herself, which I would have done, but that wasn't even mentioned to me. And that's something I'm going to have to live with for the rest of my life.
At the end of your statement, you set out briefly what your hopes for the inquiry are, and do you just want to say a word about that? A word or two about that.
Could someone scroll down?
So paragraph 50, sorry, so that's just the last paragraph, and what your hopes for the inquiry are.
Yeah, I think I just want to thank it, because I've never been able to, nobody listened to me throughout this experience, and I feel like I'm finally being listened to, and I think that this is something that nobody talks about in terms of the pandemic, but also just in general, and I think it's a story that needs to be out there. I do. I hope that the inquiry gives people like me a voice to be able to talk about the trauma that happened to them during the pandemic, and I just would never want anyone to go through anything like this again. I hope people that need to make change are listening and can make sure no one else has to experience this, because the care that I received during this miscarriage was just, I think it's affected me actually more than the miscarriage itself. I think when I think back to the care I got at the private clinic, there's something quite comforting about that. When I think back to the care I got at the hospital, it just makes me feel enraged. And I think that they could have completely changed my whole experience. It left my second and third pregnancies. I went into those pregnancies terrified, not only for what would happen with the babies and whether they'd be safe, but whether I was going to go have that same level of care again. Every time I had to phone for any reason, I was terrified that I was just going to be dismissed, and just had no faith left. I mean, luckily my concerns, that didn't happen. But yeah, I think just I don't want anyone to ever have to go through something like that again.
Well, thank you. Mrs. Watt, your witness statement as a whole and your evidence today will stand together as your evidence to the inquiry. Is there anything else you want to say before we close?
Just thank you. I think everyone I've dealt with so far has been lovely, and just thank you.
Well, thank you, Mrs. Watt, first of all, for responding to the Let's Be Heard inquiry and giving voice to what you've told the inquiry today. It's not easy, and we're grateful for that.
Thank you.
My Lord, thank you.
Very good. Yes, Mrs. Watt, thank you very much. That was obviously a very difficult experience for you, and I think you deserve great credit for having the bravery to give us that very important evidence. So thank you. And thank you, Mr. Edward. And we'll adjourn till 9:45 on Tuesday morning.
Thank you, Lord. Thank you, Mrs. Watt.